So how the cancer spreads? Usually it follows a sequential procedure where it occurs in 3 levels. Firstly, the basement membrane of the tumors themselves has to be damaged. Secondly, the extracellular matrix ingredients have to be damaged. Thirdly, at the third level, that is the basement the membrane surrounding the capillaries has to be damaged for this metastasis and invasion to occur from a primary tumor to a secondary tumor. So as the picture shows that firstly these tumor cells, they are usually attached because of certain adhesion molecules. But when these tumors rapidly proliferate, that is there's aggressive proliferation of these tumor cells, they detach from their primary site of origin, and they usually are carried as individual cell. These occur by the damage in the basement membrane of the tumor boundaries. Once the tumor boundaries is being damaged, these tumor cells are being carried away from to the next level. That is, they're being carried away to the extracellular matrix. But to be carried away to the extracellular matrix, they require angiogenesis. Angiogenesis we find in the first stage. That is, one says aggressive proliferation. This aggressive proliferation, along with associated with the proper nourishment to the tumor cells, they cause a degradation of the extracellular proper organized tumor cells. That is, they damage the adhesion molecules which are present between the adjacent tumor cells. That is, the cell adhesion molecules which are being maintained with the cadherins or the selectins is being damaged by the tumor cells and their associated proteins, which detach the adjacent cells from each other, and as well as they also show this effect on the host cells, by which they insert into the normal cells, and they from there they damage the basement membrane and reach the extracellular matrix. In the extracellular matrix, these tumor cells, they release certain enzymes known as proteases and matrix metalloproteinases, which damage the collagen matrix as well as the fibroblast structures, as well as the other structures which are being usually present in the extracellular matrix, and they occupy completely the extracellular matrix space is completely filled up with this tumor cells. From this extracellular matrix, they have to reach the blood vessel, where to reach the blood vessel, they have to damage this membrane which covers this blood vessel. So this damage is brought about by certain other factors which usually maintain the blood vessel. That is either by the platelet derived growth factors or the fibroblast growth factors. They release the certain growth factors which are necessary for this damage are being brought by these tumor cells, and they produce the self-sufficiency of the growth of the tumor cells and bring the damage to the blood vessel wall. So once there is damage to the membrane which covers the capillaries, these tumor cells, they invade into the capillaries. That is, they progress from the extracellular matrix and they move towards this capillary. For movement of this tumor cells from the extracellular matrix to the capillaries requires two agents. One is autocrine motility factor. This autocrine motility factor brings the motility, that is the movement of these tumor cells into the capillaries. Since they are small in structures, they require to transform into shape and then get into these capillaries. So this is what happens with the help of autocrine motility factors. Coming to the other molecules which are involved in this movement of the tumor cells from the extracellular matrix to the capillaries is the cleavage products. The cleavage products are nothing but from the degradation of the extracellular matrix, there are certain cleavage products which bring about the movement of these tumor cells into the capillaries, which ultimately make the tumor cells lodge into the capillaries. Once the tumor cells reach the capillaries, they start growing more in size because of the extra nourishment which is being obtained from the capillaries. Once they start attain the maximum nourishment, these tumor cells, they grow in size, they start moving out of these blood vessels in a similar way by damaging the capillary membrane, and these form the emboli. That is, they get detached from the capillaries and they form the mass of tumor cells, and they cause the obstruction of the tumor flow, and they start reaching the normal host environment where they get other nutrient supplies, that is the oxygen and the blood supply from the general host system. Usually these tumor cells are being blocked by certain immune responses, but when the immune responses have reached their maximum limit, they cannot anymore damage the tumor cells. These tumor cells start growing more and more in size, and they get adapted to the environment of the human's host lifestyle, and then they release certain growth factors also for their self-sufficiency. Among these, the growth factors are the platelet derived growth factor, fibroblast growth factor, vascular derived growth factor, epidermal growth factor. These are the growth factor which are being released by the tumor cells themselves for their self-sufficiency of the growth. This is what happens in the metastasis. This is what can be seen. That is the attachment of the tumor. At first, it gets dislodged locally, it gets dislodged, and then by the breakdown of the tumor basement membrane, then it reaches the blood vessel from the extracellular matrix, and they form an emboli that they get attached from the mass, and they form individual masses, and they are forming into a secondary tumors because of the nourishment being provided by the environment of blood vessels. This is what happens in spread of the cancer, that is by the direct spread and by distant spread. That is the local invasion and metastasis. This completes the process of metastasis. Coming now to the most commonly metastatic sites. What happens? So most common tumor among males, malignant tumors, malignant cancer, according to certain studies, first comes as a lung cancer. So this lung cancer has a predisposing, is more prone to metastasize to the bone as well as to the brain. Secondly, the breast cancer amongst the females, usually it has a metastasis prone to bone as well as the brain as well as the skin. And liver metastasis. These are the most common areas, but among them, liver is the most common area where it can metastasize. And coming to the other primary tumors which metastasize to the secondaries are the other than that is the colorectal cancer, which can metastasize to the liver. Pancreatic cancer also can metastasize to the liver. Then coming to the skin cancer, that is a malignant melanoma, most commonly it can metastasize to the bone, and from the ovary it can metastasize to the pleura as already explained, and to the liver as well. This completes the process of metastasis and the clinical and morphological features and the characteristic features of what happens in a malignant tumor. Coming to the formation of the tumor, how a tumor forms usually. Usually the formation of the tumor is known as carcinogenesis. Carcinogen means the agent which induces the formation of tumor is known as carcinogen. So this carcinogenesis is formation of the tumor, malignant tumor. It is also known as oncogenesis or tumorigenesis. The normal growth of a cell is usually under the certain control of certain regulatory genes. So and certain genetic molecular mechanisms which control the normal growth of a cell. Similarly, a tumor cell also requires this growth factors and certain genes which have to regulate its growth. So we are going to briefly explain now what happens in the molecular basis for a formation of a tumor cell. Usually when there is any damage to any cell, it could be a DNA damage, usually the damage mostly the target of damage is DNA in any cell. So this damage can be brought by carcinogens, which could be a radiation carcinogen or a physical carcinogen or a non-radiation carcinogen, biological carcinogen or a chemical carcinogen. So there are various carcinogens which can bring about this damage. So whatever the damage is, whatever the etiological agent is, the primary target of the region is the DNA. Once there is damage in the DNA, that is the genetic material of the cell is being damaged. So this genetic material, this can be carried. This can be induced genetically damaged or otherwise inherited. That is, it can be transferred from generations, that is from the fathers to the offspring, or otherwise it could be induced damage. So this is what happens in case of mutations. So this damage could result in damage to the genetic level or the epigenetic level. That is the chromosomes could be damaged, otherwise the biological mechanisms which maintain this chromosomes and the chromosomal division can also otherwise be damaged. This is what happens in genetic and epigenetic changes. So coming to all these things, keeping all these things aside, what are the features in normally which regulate the cell growth? There are the few genes which usually regulate the cell growth. They are, first is the growth promoting genes. These are known as Proto-Oncogenes. So we find certain set of Proto-Oncogenes which usually promote the growth of a cell. And then comes the anti-oncogenes, that is which drive the damaged cells or the any chromosomal abnormalities from the fathers to the offspring, they drive these to death by apoptosis, by process known as programmed cell death. So this is what is the function of the anti-oncogenes. They are also known as tumor suppressor genes, that is, they suppress the growth of abnormal cells. This is what happens. And coming to the other set of genes, they are the apoptosis driving genes, that is the apoptosis regulating genes. So this cell which is being damaged has to be brought to the death. So this is being maintained by the apoptosis regulating genes. So these genes are mostly, they are of two types, apoptotic regulating genes. There could be a pro-apoptotic genes, that is, they regulate the process of apoptosis, or otherwise inhibit the process of apoptosis. They are known as anti-apoptotic genes. Among the pro-apoptotic genes, they are of three types: BIM, BIX and BAD. These are the abbreviations given for these genes. And coming to the anti-apoptotic genes, that is BCL2 and BCLX. Since these were found in the B cell lymphoma, they were termed as BCL. This what is anti-apoptotic genes and pro-apoptotic genes. The genes which are being driving the cells, unnecessarily cells to damage, and the cells which have to be survived, they are being protected by the anti-apoptotic genes. This is what happens. Coming to the DNA repair genes, these genes which repair the damage which has been occurred by the carcinogens, these are being by the DNA repair genes. So these are the four set of genes which usually regulate a normal cell growth, whereas in a tumor cell or a neoplastic cell, which is a malignantly transformed cell, these cells are also being transformed, maintained under these set of genes, that is the proto-oncogenes. Usually proto-oncogenes are the inactivated genes, that is, they normally control the growth activity. But when these genes are being inactivated, that is, they form into an oncogenes, that is, they rather promote the neoplastically transformed cells. Rather than being these cells being suppressed by the anti-oncogenes, these are being promoted by the anti-oncogenes, that is, they promote the mutated cells to further divide, further promote their cell. This is what is oncogenes. And suppression of the anti-oncogenes, that is, in malignancy, the genes which drive these tumors to the death, these tumor suppressor genes or the anti-oncogenes, they are being also mutated in the malignant tumors, which so that the mutated cells continue to grow because of the absence of this tumor suppressor genes. And then apoptotic genes, that is, the cells which are actually involved in cell death, the genes which are involved in cell death but usually do not function because of the mutations, and they carry these damaged cells which usually progress to form the malignant tumors. And similarly, the DNA repair genes, which are amongst the anti-suppressor genes, they also are being mutated and do not drive the damaged genes to death, but rather they help the proliferation and the carrying of this DNA into the progressing population of the tumor cells. This is what happens in the basis of the tumorigenesis or oncogenesis. Coming here, this is a picture which shows that the normal cell which divides and completely, and when this cell is being mutated, it results in a formation of neoplastic cell. In this neoplastic cell, because of the absence of the anti-oncogenes or the presence of the oncogenes, is being driven to the further division, rapid metabolic rate, which divides more and forms a tumor mass or mutated mass of cells, tumor cells. So what happens in the genetic mechanism of the cancers? Usually we find that there's hypermethylation. Methylation is a process where methyl groups are being added to a DNA, which is a normal process in maintaining or regulating the cell differentiation from the stem cell to a mature cells. This is being brought by methylation process. But whereas we see there's hypermethylation or hypomethylation, which is usually occurs in location of these tumor suppressor genes. So this tumor suppressor genes become inactivated or otherwise mutated, which cannot regulate its normal activity. This usually hypermethylation occurs in CpG island. This CpG island is the code or the sequence which is being carried in a DNA. Usually we know that DNA consists of nucleotides, that is they could be purines or the pyrimidines. So C stands for cysteine, that is the C stands for cytosine and G stands for guanine, and these are being combined by a phosphate, one phosphate. That is what is CpG, which determines. So this CpG island undergoes hypermethylation, that is increased in the methylation groups. That is methyl groups are increasingly being added to the DNA, which obstruct the cell differentiation to the formation of a mature cell, which also this CpG hypermethylation usually occurs in a tumor suppressor gene area, that suppresses the growth of the tumor cells. So by causing damage to the tumor suppressor gene, the tumor suppressor gene does not function normally. Rather, this tumor suppressor gene gets inactivated, and once it is inactivated, that is a tumor cell, it progresses in its growth. This is what happens in CpG island of hypermethylation. So usually hypermethylation is a constant. Hypomethylation is a constant companion to the hypermethylation. So any hypermethylation or hypomethylation usually causes an DNA adduct, that brings about damage or any inactivation of the tumor suppressor genes, and which ultimately results in a failure in the process, or otherwise diversion in the process of cell differentiation from a stem cell to a mature cell. This is what happens actually with the hypermethylation or hypomethylation process. And in cancers, since they affect the tumor suppressor genes, there is no suppression rather of the abnormal growth of the tumor, rather there is progressive growth because of these damages or genetic changes. So this results in formation of tumorigenesis. Associated with this hypermethylation and hypomethylation, along with that, we see that there is point mutations, that is, there is change in only a structure of the chromosome usually. This can be observed. And coming to translocation, that is change in the chromatid arms, that is, they may be translocated from one area to another chromosomal number. As we see in Philadelphia chromosome, that is translocation of the chromosome from 9 to 22. In Burkitt's lymphoma, we see transformation from 8 to 14. So these are the certain translocations which we see. Chromosomal instability, because of the chromosomal amplification or the chromosomal replication, because of the increase in the number of chromosomes than the normal, the chromosome becomes instable. And deletions could also be a result of these genetic changes. And this is what happens because of the this is what happens in the genetic and the epigenetic changes, which form in result in tumorigenesis, that is formation of a tumor. Associated with these, we can say usually when in signal transduction pathway, we see that a growth factor which acts as a signal usually comes and attaches to its growth receptor, which is present on the cell membrane. From the growth receptor, these are being carried into the intracellularly from the extracellular environment with the help of certain cytoplasmic or transformational proteins. These are cytoplasmic or transductional proteins. These proteins carry this information from the intracellular, that is the cytoplasmic region, to the nuclear region. From the cytoplasmic region to reach the nuclear region, it requires certain nuclear transcription proteins. So from the nuclear transcription proteins, they have to reach the cell cycle for the cell division to occur. So this is what happens in a normal signal transduction pathway. But whereas we see in the malignant tumors that there is alteration in the signal transduction pathways because of the starting from the signal transduction pathway of the growth factors to the growth factor receptors to the transduction cytoplasmic or transduction proteins or the nuclear regulating proteins or the cyclin cyclins or the cyclin dependent kinases which are involved in the cell cycle. So there are mutations in certain areas which result in the formation of the tumor growth. So let's see what happens of these. Suppose what happens in the mutation starting from the growth factors. So starting with the growth factors, usually the growth factors which bring about the signals when there's mutations in this platelet derived growth factor beta, which usually the growth factors, there's no abnormality in the growth factors, but rather there's overexpression of the proto-oncogenes which code these growth factors. Because of that, we see certain mutations. So we see the overexpression of the proto-oncogenes, cis proto-oncogene, which encodes this platelet derived growth factor in case of sarcomas, because of we see its presence in sarcomas. Similarly, the transforming growth factor alpha, the overexpression of the proto-oncogene which encodes this transforming growth factor transforming growth factor alpha, we see its overexpression in cases of carcinomas. And coming to the fibroblast growth factor, that is this growth factor which is being encoded by epidermal growth factor receptor or the human epidermal growth factor receptor 2. This overexpression of this gene causes it can be observed in breast cancer. Similarly, there's a hepatocyte growth factor. So overexpression of this growth factor can be seen in cases of medullary carcinomas of the thyroid. This is what happens. These are the few illustrations of the overexpression of the growth factors which can be observed in certain cancers. Coming to the receptors of the growth factors, we see that the epidermal growth factor receptor, that is, as we have seen in the growth factors of the epidermal growth factor receptor, which most commonly involves in the carcinoma with breast cancer. Similarly, we see its overexpression in the breast cancer epidermal growth factor receptor. Coming to the c-KIT receptor, that is, it is so called c-KIT receptor because it is a stem cell factor, or otherwise known as steel factor. This has been observed in located in the stem cells. So it is known as c-KIT, and this c-KIT, it usually mediates the cell proliferation by activating a pathway known as tyrosine kinase pathway. This tyrosine kinase pathway is a pathway which helps in progression of the cell proliferation. So this tyrosine kinase pathway is a pathway associated c-KIT receptor is being overexpressed in cases where where it is usually observed in gastrointestinal tumors. This overexpression of this c-KIT receptor has been observed in gastrointestinal tumors. This can be given as an example of overexpression of the receptors which involves the tumors. Coming the red, this is the rearrangement during the transfection. This has been observed in certain tumors which causes the rearrangement during transfection. That it has been observed in certain carcinomas of the thyroid. So this gives an illustration of the any mutations in the growth factor receptors. Coming to the since the signal is being from the external to the internal environment, extracellularly to the intracellularly, the signal is being carried through the cytoplasmic or otherwise the transduction proteins, among which we see that there is mutated RAS. The RAS, which is usually activated, which is being inactivated by the GTPase activity. This enzyme GTPase usually inactivates the RAS, but in mutated RAS form, we see that even in the presence of GTPase, this RAS remains in a activated form. This is what happens in a mutated RAS. This mutated RAS is observed almost in thirds of the tumors, that is in almost most of the tumors it is being present. So RAS is what which is being abbreviation of a rat sarcoma gene. Since it was first observed in a rat sarcoma, it is known as rat sarcoma gene. Coming to the BCR or ABL gene. This gene usually, ABL gene is usually a gene which is being translocated in lymphomas from its original location to the BCR, that is breakage cluster point region, that is from chromosome 9 to it is being translocated to chromosome 22. So this is being observed in cases of Burkitt's lymphoma. This is what is a mutation which is being carried in Burkitt's lymphoma. Coming to the nuclear transcription factors, Nmyc gene is a gene which was being first observed in myelocytostomatosis, which is a disorder. So this gene was first observed in that disorder. So that is the reason it is being encoded as Nmyc gene. This is an oncogene. So usually we find this overexpression or the translocation, or we have seen Nmyc gene translocation has been seen in lymphomas. So there has been there is formation of nuclear transcription factors. There will be obstruction in this nuclear transcription factors resulting in sarcoma. Next, coming to the Nmyc gene, usually this Nmyc gene has been seen, there's amplification of the Nmyc gene usually found in neuroendocrine tumors. Coming to the Lmyc gene, this was also being observed in certain leukemias. The mutated form of this leukemia has resulted in formation of this Lmyc gene has resulted in formation of leukemias. Coming to the cell cycle regulatory protein, as we know, the cell cycle is being regulated by cyclin dependent kinases as well as cyclins. These are so termed because of the process synthesis. They are synthesized using the cell cycle formation as well as being degraded during the cell cycle formation. So they are known as cell cyclins and cyclin dependent kinases. These are enzymes which regulate the process of cell cycle, which will be discussed further. So we find that the cyclin dependent kinase, there is mutation in the cyclin dependence cyclin D, that is progression which is involved in the progression of the phases of the cell cycle. There's mutation in the cyclin D as well as cyclin E and cyclin dependent kinase 4, which brings the damage or the mutated cell to continuously proliferate and result in the formation of malignant tumor. This is what happens in the genetic mechanism of the cancer. So, as we say, the cancer causing agents, that is the carcinogens, when they attack the target, that is a DNA, there will be damage, that is a activation of the, there will be damage of the proto-oncogenes. Once these proto-oncogenes are transformed into oncogenes, they progress the formation of the mutated cell to undergo further replication and result in the formation of a malignant tumor. This is what happens, and this is what the picture represents. So what happens for a proto-oncogene once it gets mutated? So once it gets mutated, it can result in the translocation, otherwise transposition, that is change in the formation of a chromosome from one location to the other location. As we have seen in Burkitt's lymphoma and Philadelphia chromosome, this translocation of this chromatid arms. This results in the formation of mutated cells, which allows the further replication of this continuous mutated cell and resulting in the formation of a malignant tumor. So the translocation results in gene proteins or otherwise gene fusions, and the connection is otherwise separated genes. Then it also causes the disabling of the genes, that is the genes becomes handicapped. Say they can become handicapped because this translocation, that is the long arm of 9 chromosome is being translocated to the chromosome 22 in case of Philadelphia chromosome, which is seen in chronic myeloid leukemia. This is what is observed, that is handicapping. The genes become handicapped or otherwise disabled. This is what happens because of the translocation or the transformation of the chromatid arms. Otherwise, they are even create errors within the genes by insertion of these translocated elements, that is chromatid arms being moved from one position chromosomal region to the other chromosomal regions. This happens in the translocations or when protogenes are being mutated. The other set is gene amplification, that is the increase in the number of the genes, that is replication. Once there is increase in the number of the genes, that is as the genes even for they're important even in the formation of the proteins, there's increase in the protein formation levels. This increase in the protein formation levels can also cause a dysregulation of the cells. Since there is increased or unrequired amounts of protein, this causes the cell growth to be dysregulated and also cause certain resistance to the drugs. When the drugs are being targeted to certain regions, because of the increase in the number of the unrequired substances, they become resistant to these drugs and further cause a continuation of the tumor growth. So coming to the point mutations, these point mutations can be of two types. That is, they might include within a control element, that is, they might affect they might bring the changes, mutations at the epigenetic level, or otherwise they might bring changes at the genetic level. So if they bring changes at the epigenetic level, what happens is there will be change in the entire expression of the gene. That is, they bring about changes in the expression of the genes. The gene could be overexpressed, amplified, or otherwise translocated or deleted. This is what happens when a point mutation, that is there will be a structural changes in the gene. This might also interfere in the splicing of the mRNA, transcribed or pre-mRNA. That is usually, as we know, mRNA carries the message or the sequence which is supposed to be guarded and guided for the protein synthesis. There will be splicing, that is because of the mutations of the epigenetic level, there will be editing of this message or the sequence, by which there will be abnormal protein formation, abnormal sequence of the protein formation. This will lead to errors in the protein production of the protein. This is what happens if the point mutations occur at the epigenetic level. Suppose the point mutations occur at the genetic level, they cause changes in the function. That is, there will be change because since the gene sends the messages and it transform the hereditary structures, there will be changes in the functions, activation, stability, as well as location of the proteins if there is change within the gene. This is what happens if the proto-oncogenes are being mutated and transformed into oncogenes. Coming to the tumor suppressor genes, when the proto-oncogenes are being inactivated and transformed into oncogenes, that is, these oncogenes help the formation of the tumor cells to progress as a mutated cell rather than being repaired. They are being progressed as a tumor cells, that is, a mutated cells, that is, the mutations are being carried to the next generation of the tumor cells. So these the tumor cells which are being carried to the next generation are usually being suppressed or being removed by the tumor suppressor genes if they are being properly functioned. But in these tumor suppressor genes, which are actually involved in the process of elimination of these mutated cells, are being this tumor suppressor genes are being mutated. That there is loss or abnormal function of this tumor suppressor genes. There is no the progression of tumors is in a helpless condition. Thus these damaged cells, they are not being driven to the apoptosis, that is the next process, rather they are being progressed to the proliferation of the cell. So what happens if the mutations are in the tumor suppressor genes will be seen here, is being seen in the picture here. Mutation, it inactivates the tumor suppressor gene and the cells continuously proliferate. Once the cells continuously proliferate, the mutations they are in such a large number that they inactivate the DNA repair genes, that is the genes, that is the tumor suppressor genes, which actually repair the damaged genes, are being mutated, and these mutations are being carried on to the subpopulations of the proliferating tumor cells. So mutations of proto-oncogenes creates an oncogene. This tumor Proto-Oncogenes gets converted into an oncogene, that is which regulates the proliferation or the growth of the tumor cell, and this will cause the inactivation of the tumor suppressor gene and results in the formation of a tumor mass and resulting in formation of cancer. So coming to the few tumor suppressor genes, which are the most important genes. First, it is the Retinoblastoma gene. It was the first identified tumor suppressor gene. It is usually located in the nucleus in the chromosome 13 and of the long arm of chromosome 13, long arm which is being abbreviated as Q arm, and short arm is being abbreviated as P arm. P means petted arm, that is the short arm, and as a sequence of P is the letter Q, so it is known as long arm. So Retinoblastoma gene, it is placed in the nucleus of the chromosome 13 on the long arm of chromosome 13. Usually we find that this tumor suppressor gene, that is a retinoblastoma gene, it is being mutated in cases of cancer such as retinoblastoma and osteosarcoma. So coming to the BRCA gene, that is a breast carcinoma antigen, that is they are of two types, breast carcinoma antigen 1 and 2. Usually they are also located in the nucleus. Usually they are located in the chromosome number 17 and in the loci, that is a long arm of chromosome 17 in the 21 lesion of loci. So they are usually found in carcinoma of breast as well as in the ovaries. Coming to the next set of genes, tumor suppressor genes, they are the transforming growth factor beta and its receptor. Usually they are present extracellularly, since they are the growth factors which carry signals from the growth factor that extracellularly to the intracellular to the receptors. So they are present extracellularly. So they are seen mutation of these transforming growth factor beta usually in carcinomas of the pancreas and the colons, or otherwise the stomach cancers. Coming to the next set of genes, that is the NF genes or the neurofibromatosis genes 1 and 2. Since they have been observed in neurofibromatosis cancers, they are known as neurofibromatosis gene 1 and 2. They are usually present in the plasma membrane. Coming to the next suppressor gene, the most important gene, that is the P53 gene or the tumor suppressor gene, usually found in the chromosome 17 and the short arm of the chromosome 17 in the nucleus. They are usually involved in maximum of the tumors. Among them, most common are the head and neck tumors and the carcinoma of lung, colon and breast. Coming to the Williams tumor gene, that is Williams tumor gene is a tumor gene of a childhood tumor which has been observed. That is, it is a gene which is being present in the nucleus and it is placed in, usually located in the chromosome 11. That is the short arm of chromosome 11 it is usually located. This adenomatosis polymo coli gene was being first observed in this disease, so it is known as APC gene, and this APC gene is being activated by a protein known as beta-catenin. This beta-catenin is involved in the activation of this gene. So this gene is located in cytosol and it is usually seen most commonly in the carcinoma of the colon. This completes the tumor suppressor genes. So what happens during for a cancer cell to be formed, starting from the initiation stage to the promotion stage and the transformation stage or the progression stage is being demonstrated in this flow chart. That is when a cell is being exposed to a carcinogen, then there will be transformation of the microsomal enzymes, that is the enzymes which are present within the cell. And then these cells, they cause the formation of the reactive molecules. As we know, enzymes are the molecules which bring about the metabolic reactions. From this metabolic reaction, there are certain byproducts formed. Among these, free radicals are one of the byproducts which act as a damaging agent or otherwise a carcinogens, which cause a damage in the cell. And since the target of damage in any cell is the DNA, this causes a damage in the DNA, and this damage is being continued if this damage is not being removed by the DNA repair genes, and this damaged DNA continues to proliferate and this damaged DNA which is being constituted in the cell is known as initiator cell. This initiator cell continues to proliferate and forms a proliferator cell. This proliferator cell undergoes further division, that is progresses from the initiation stage to the promotion stage and results in the formation of benign tumor. So what happens in the proliferation stage, that is the promotion stage or the proliferation stage, is the damaged DNA carries the inherited characters, that is the alteration in the DNA expression or the DNA composition. As already explained, it could be translocation, amplification or deletion, which could be any kind of altered gene expression. Other than that, it can also be vitamin A metabolism. Vitamin A metabolism, by certain studies and certain scientists have observed that these vitamin A usually drives the stem cells to form a blood forming cells, which is a most important factor for a tumor to progress, because so if the tumor is not being supplied by sufficient nutrition or the sufficient nourishment which is being produced usually by the blood forming cells, which also carry the oxygen and the nutrition, there is no formation or there is no continuous progression of this tumor. So this blood forming cells form a major agent for the progression of any tumor. So this being supplied by the vitamin A metabolism, which has been being brought into a concept by certain studies. So this promotion is being brought by vitamin A metabolism, altered gene expression, as well as with the suppressed immunoresponse. Usually a host has a property to fight with this tumor cells, but when the immune response has been lost, that the patients become completely compromised, then this causes the promotion of this tumor cells, and this results in enhanced cell division, that is the cells continuously proliferate and form the progression of this tumor and come to the stage of progression stage, where there is exchange of DNA between the chromosomes, that is the altered DNA only becomes exchange between the chromosomes, transforming from the parent cell to the daughter cell of the offspring, as well as expression of the oncogenes, that is the genes which promote these growth of the mutated cells, and ultimately thus along with these mutations there are additional mutations which are being carried throughout the generation and result in the formation of cancers. This is what happens in the sequential stages from a mutated cell to a formation of cancers. First, occurring in three stages, that is the initiation stage, promotion stage and the progression stage. The similar diagram which shows that DNA damage being because exposed to endogenous pigments or the exogenous pigments agents which could be directly related or indirectly related. Then this brings the epigenetic changes as well as the genetic changes, as already explained. This causes the DNA damage, and this DNA damage is being carried to the progressing generations because of the lack of this DNA repair. This mutated DNA is being carried to the progressive generations and results in huge unrepaired DNA damages and forms the large increase in the mutations and forms the epigenetic alteration, and finally causes the progression to the cancer. This is what happens once the DNA is being damaged. These the damages could be at the genetic level, epigenetic level, or the somatic level, or the germline level. That is, during the germline damage includes the cells which are in the germline stage, that is in the developing stage. Somatic changes which are being transformed from parent cell to the daughter cells. What happens in the cell cycle is, usually we see as a cell progresses from certain phases of the cell cycle. First is the G0 phase, also known as quiescent phase. Then comes the G1 phase, or the pre-mitotic phase, or the gap phase 1. Then comes the synthetic phase. That is the synthesis phase, which includes where the DNA synthesis occurs. In the pre-synthetic phase, or the G1 phase, we find that the proteins which are required for the synthesis of DNA are being prepared in the gap1 phase. Coming to the gap2 phase, since it is a stage which precedes into the mitotic phase, this gap2 phase synthesizes the proteins which are required for the mitotic divisions, as well as the DNA which has formed in the synthetic phase, that is in the prior phase of the G2 phase. These DNA which are being synthesized become stabilized, and any corrections of these DNA which are being abnormally formed are being corrected in the G2 phase. This is what happens in the cell cycle of the phases of G0, G1, S phase, G2 phase, and M phase. These phases are being controlled by certain checkpoints which consists of cyclins and cyclin dependent kinases. So coming from the this G1 phase to the G2 phase is being mediated by cyclin A as well as cyclin dependent kinase 2. From G1 phase to the synthetic phase, this is being mediated by the cyclin A as well as cyclin dependent kinases 2. And then from synthetic phase to the gap phase, there's no checkpoint, that is, there's no change, but rather from the G2 to the G1 phase, that is from the G2 to the G0 or G1 phase, there are certain checkpoints, that is a cyclin B, cyclin dependent kinase 1. Coming to the most important mutations involving in the cell cycle is a cyclin dependent kinase usually 4 as well as cyclin D. These are the mutations which are usually occurring in a mutated cell which is being carried to the progressing tumor cells. This is what happens. So usually any DNA damage is usually being corrected in the G1 phase, that is under the control of cyclin D as well as cyclin dependent kinase 4. These DNA repair is being brought by the RAS gene as well as a tumor suppressor gene, which have been already explained in the previous session. So coming to how the tumor suppressor gene shows its function. Once a cell is being damaged because of any carcinogen or otherwise direct damage, that is because of the irradiation, or otherwise any cell cycle abnormalities, or otherwise because of any conditions like hypoxia, decrease in the oxygen content, this P53 gets activated. So coming to P53 usually gets activated either by the DNA damage, or usually it gets activated in certain conditions like DNA damage, or otherwise in any cases of cell cycle abnormalities, or otherwise in case of hypoxia when there is decrease in the oxygen content. So P53 majorly it has two functions. First function is in the mitotic activity, that is it drives the cells which are present, that is from the quiescent phase or the G1 phase to the it repairs them in the G1 phase, which are the cells which are about to divide, or otherwise it also has a function in the apoptosis, that is it prevents the cells to further progress from G1 phase or the G2 phase into the synthetic or the mitotic phase, that is it drives them to the apoptosis. This is what is the major function of the P53 gene. And this P53 gene usually it is being identified by the murine double minute 2, which is a which identifies the domain of this P53 gene and shows the negative regulator, that is of the inhibitory transcription activation of this P53 gene. Once they both bind together, murine double minute 2 homolog, once this binds to the P53, then P53 gets activated and usually it arrests the cell cycle arrest, that is in cases of mitotic activity, mitotic functions, it arrests the cell cycles in the G1 phase and then causes the DNA repairs and then causes the cell cycle to restart. So by creating a cellular as well as genetic stability, whereas in apoptosis we find in the G1 as well as in the G2 phase, this P53, what happens is it drives the cells which cannot be repaired to the elimination process. It drives them to apoptosis, that is to the death of the cell, and causes the stability of the cell as well as genomic constituents. This is what happens in the tumor suppressor genes as well as in the cyclin dependent kinases and cyclins which are involved in the cell cycle regulation.